This is a case of a 73-year-old woman who presented with a history of massive PR bleed and diarrhea and possible diagnosis of colitis. CT scan angiogram was performed. Let's go directly to the finding. Here is the distal transverse colon, and we can see the IV contrast arterial blush. However, this is a portal venous phase, but we have the post-contrast and the arterial phase, so let's compare the images. Here is the post-contrast. This is the pre-contrast image. Here is the post-contrast in arterial phase and here in portal venous phase. There is no hyperdensity in the pre-contrast. There is mild hyperdensity in this region, irregular hyperdensity in the arterial phase, and little later in the portal venous phase, the extravasation is more prominent. And this is the right protocol to include all these three phases in the CT scan to rule out active bleed in the gastrointestinal tract. Sometimes active bleed needs some time to be depicted in the CT scan. It is not well depicted in the arterial phase, but it is very well depicted in the portal venous phase. By the way, there is significant mural thickening in several locations in the large bowel. Here is the ascending colon and the right colonic curvature. We can see that there is significant thickening, edema, and mucosal enhancement. Again, here in the distal transverse colon, where the active bleed is seen, there is significant mural thickening, mural changes. The findings are highly suggestive of colitis with this complication. The region of active bleed in coronal view, we can see the significant mural thickening of the large bowel and the extravasation, the active bleed. I say again, it is very helpful to compare the images with the non-contrast, the pre-contrast, to confirm the right diagnosis. With the post-contrast images alone, we are not sure if this represents a true extravasation, a true active bleed. Dear friends, thank you for watching this video. See you the next time in my next presentation.